It's Kimmy with Mouth Muscle Memory, and I wanted to talk about my experience being an adult with a tongue tie. As you may know, tongue ties are genetic. They are a defect that happens when we're in the womb, and the little string under the tongue doesn't fully dissolve is a good word for it. It doesn't go away completely. Everybody has a bit of a string under there or a frenum, but in some people it's more pronounced than others, and it can cause tightness or cause the tongue to rest low in the mouth, which will be a contributing factor to those myofunctional disorders or mouth muscle compensations to overcome that tight attachment. So my experience is when I was a small child, as far back as I can remember, I was a restless sleeper. People would complain about sleeping in a bed with me because I would kick or toss and turn or roll all over the bed. So I want to say around the time I was 5 years old or so, nobody would want to share a bed with me. I also would wake up grinding my teeth. Again, as far back as I remember being a small kid, and I would wake up with my teeth rubbing each other so hard it would wake me up out of his sleep. I never was a bedwetter, but I had many vivid nightmares. I had dreams that I was going to the bathroom. Luckily for me, I didn't wet the bed, but I had chronic nightmares pretty much every night of my life since I was a small child. Always was waking up or going to my parents saying I was scared or had a bad dream. So that continued honestly up until I had my tongue tie released, and then after that I really don't get those nightmares every single night. It's frustrating now knowing that that's a common symptom of a tongue tie or a small airway or sleep disordered breathing, because I asked so many people, doctors, therapists, dentists, why that happened, and people would just tell me that it was your brain processing information. Nobody told me that it could be a sign that maybe I wasn't breathing well at night. By the time I was in college, 17 years old in college, I flattened out my front teeth. They were really worn by then. I didn't know about night guards at that point. I was just wearing my orthodontic retainers, which were the wired kind that didn't protect the chewing surfaces of the teeth. So this is my teeth now. Canines completely flattened out. If you look carefully, they match up in perfect points together. Where I would grind. I used to wake myself up grinding like that. The reason why I bring that up is grinding is signs of low oxygen to the brain, and right before a grinding episode in the sleep, there'll be a drop of oxygen to the brain, and the brain will send a signal to the jaw to help open up your throat. So say I'm laying on my back, my jaw would move forward and move. Dr. Liao, he says that teeth grinding is like CPR in your sleep. So my symptoms were teeth grinding, clenching, nightmares, tossing and turning, kicking, dreams about using the bathroom but not actually bedwetting, but a common side effect is bedwetting. always tired, always tired. On weekends, I would need to sleep 12 hours to feel like I was getting enough sleep. During the week, I have a very strict bedtime. I have to have 8 hours or I don't function well. So I took a course just to learn about what myofunctional therapy was, and it made so much sense for me because during the continuing education course, I realized that I had myofunctional disorder. I've had it since I was probably a baby, really, if I had a tongue tie. And no one had ever found it. I went to one of the highest ranked orthodontists in Utah, very, very well known, very elite orthodontist, but they never looked at my tongue, never saw it as a problem. I couldn't breathe through my nose. I got allergies, I want to say my mom said around 5 years old, and I stopped breathing through my nose and I started mouth breathing. The problem with mouth breathing is you're not putting your tongue up in the roof of your mouth to help guide your growth when you're a child, so the tongue is lazy and it hangs out on the bottom of the mouth or behind your bottom front teeth, doesn't guide the growth of the palate. So when I was a kid at the dentist, they always said, oh, you have a really strong tongue, you've got a bossy tongue. I was a really bad gagger, like getting x-rays or fluoride trays was torture for me. I hated the dentist. I had a lot of fear and anxiety about it, and honestly it's because I couldn't breathe. Like, getting dental work done when you can't breathe through your nose is torture. So when I was a child, I started getting really crowded. They said I had buck teeth. It's not necessarily that I had giant teeth, I just had a very small mouth. So they took out 4 of my permanent teeth, or my bicuspids. So I only have 1 instead of 2. And we don't do that anymore, or we shouldn't do that anymore, because you're actually shrinking the mouth, shrinking the face, and orthodontics gave me sleep apnea. The roof of my mouth, they put in a palate expander. It wasn't super successful because I'm still very narrow, and I have a large tori, or palatal tori, on the roof of my mouth. If I lift my head back, you'll see it. It looks like a large bump on the roof of the mouth. It's not normal. They're really common, but you only see them in teeth grinders and clenchers. So I'll tilt my head back and you can see it. So in the picture you can see when I do the suction hold, the frenum, or the string under the tongue, is pronounced. The floor of the mouth, everything had to lift to help give me more range of motion with the tongue. So it was worse than it looked, and that's what they call a posterior tongue tie. When I went to a class, a doctor wanted me to let them just snip the frenum real quick with the laser as part of a demonstration, but I suspected that it was worse than it appeared, and luckily there was a preferred provider, a tongue tie specialist in the class, and I had him look at it, and he told me and confirmed that I did have a posterior tongue tie, which is more complicated and more time-consuming procedure. It's more in-depth on how they need to release it. So, in September of 2019, which was, about 5 months ago from now, Dr. Witkoff did the surgery for me. He used a laser to relieve the frenum, and then scissors and scalpel to get into the posterior portion of the tongue. So basically relieving the string with the laser, and then cutting into the floor of the mouth, right around the base of the tongue, to help give me more range of motion so my tongue can elevate and lift up into the roof of the mouth and out of my throat. I'm not gonna lie, the surgery was more difficult than I expected. I have generalized anxiety, so the anesthetic had epinephrine, which made me feel really anxious, and I was had what they call an epinephrine reaction, where I just cried and my heart was racing from the medication and the anesthetic. But the procedure wise, it was fine. There was so much restriction inside of the muscle of the tongue and the fascia and tissue underneath that they had to cut and relieve some of the muscle under the tongue, inside of the tongue, what they call the genioglossus, and then afterwards put some stitches in. It was more intense healing than I expected, but I also had an unusual reaction. Most people, they're fine, maybe 2 days later. For me, I wanted to make this video just in case anyone is struggling with their post-frenectomy surgery. So I just wanted to share my experience in case anyone is having a hard time and wants to know that there's hope. So the first day I was in pain, so I went and got ibuprofen. I had tramadol, one day's worth of tramadol for pain. He also gave me a lidocaine gel that I could use for stretching or for pain to use topically, like a stronger aura gel but made out of lidocaine. It wasn't quite strong enough. I was still very sore and very tender, so I got some CBD oil and put it down there right on the wound to help with some of the pain. I had high hopes to go play volleyball, and I had a couple dates scheduled that weekend, and I had to bail on all of them. I just needed to be home watching movies, kind of just resting. It was definitely something I should have realized it would be more intense than it was, but I felt very nauseous from the bleeding and having to take ibuprofen every few hours. It kind of started to hurt my stomach. Most people can eat pretty well, but for me, because they had to go so deep, I was very tight. I tried to eat regular food, and my tongue was so stiff at that point that I couldn't eat regular food without choking. So I was on a liquid diet for about 6 days. Just milkshakes, smoothies. I think I had green chili. Anything that I could do to just not chew. It was really hard for me to swallow normally. On the bright side, made me very empathetic to people that have swallowing problems or, different types of myofunctional disorders, because I had to really compensate for my tight tongue, having to swallow like this. lift my head up or use my whole head to swallow those first couple days because it was just so tight. One of the most helpful things that I learned during my post-surgery, I had a lot of discomfort and tightness around the base of my tongue, and when I would do my stretches, I didn't feel like it was helping. So someone taught me how to do a floor of the mouth massage, and I wanted to put that on here because it was so helpful for me. It really helped with that pain and tightness. So what you do is you take your finger and you drop it down to the floor of the mouth, under the tongue as far down as you can go, and rub under the bone. You don't need to use a lot of pressure, but you'll feel almost like little tiny guitar strings and a little bit of tenderness, but that helped me a lot. As well as when you grab the angle of the jaw, hook your thumb and slide it right there at the angle of the jaw and just slide it down. This spot was magical for me when I had my tongue tie surgery. So, after about 6 days, I could eat soft foods. Another funny thing that happened with me, because I had so much tightness and they had to go so deep into the tongue muscles, I had a speech impediment for 2 weeks. Again, not a common side effect that most people get, but I guess I got all the hard stuff so I could be a good teacher. So my tongue was so tight, especially when I had the stitches in. I talked like this for like 2 weeks. Limited opening still, and my voice is so different. I cannot talk normally. It's kind of funny. It's been like this for a while. I was a little concerned that maybe my voice was never going to be the same, but I was okay with it because the day of my surgery, even when I was super tight, I stopped grinding my teeth, which was miraculous. I have ground my teeth every day since I was a kid. I'll show you a picture of my night guard. Now bear with me because night guards are disgusting, but can you see all those gashes in my night guard? How nobody knew I had sleep disordered breathing, sleep apnea is beyond me. This is not normal. If you are grinding your teeth and you're beating up a night guard like this, you need to see someone who does sleep apnea treatments or an airway dentist or find a Vivos provider. This is not normal. So now post frenectomy, I don't grind my teeth and the clenching is much better, especially since I've learned that clenching is because the tongue is not resting and suctioning in the roof of the mouth. So, to teach yourself to keep your tongue suctioned in the roof of the mouth, smile, swallow, and then just leave your tongue up. What this looks like on the side, the double chin is actually the tongue. So watch what happens when I raise my tongue up into the roof of my mouth. Lazy tongue, tongue suction. and that is the key to clenching. Anyway, so all in all, I'm really, really, really happy I did the frenectomy surgery. It's been life-changing. My sleep is so much better. My dark circles, which are not great, but they're doing much better. I feel more rested. My memory problems are improving. I know that I'm not going to be 100% until I do expansion. So I'll be doing a DNA appliance through Vivos at Aspen Dental. And what that's going to do is it's a growth appliance that works on adults as well. It will slowly expand the bones in the mouth to bring everything out and forward, so then my tongue has more room and it will treat and cure airway problems, upper airway resistance, sleep apnea, sleep disordered breathing. I can't wait. So anyway, that's my story, and I hope it's helpful. If you're feeling overwhelmed or you're scared about the worst thing that could happen, it happened to me, and I'm still grateful I did it. If you're struggling with the aftercare and you're worried that it's not going to get better, I feel like 2 weeks was when I was pretty much talking normally, eating normally. The swelling had gone down. The little wound hole had closed up around 2 weeks, and I was feeling pretty good. Tightness happened for the next 1 to 2 months, so I made sure I was really diligent about my myofunctional exercises. Now I feel like I have a new tongue. And this is my opening now. Maximum opening and then tongue to the roof of the mouth. Much better. And it feels really good. So if you're worried about it or you're not sure if you want to do it or not, give it a try. Worst thing that could happen, you don't feel better, you probably just have a small airway and you need expansion. But we can work through that as well. All right, thanks.